I'm Dr. Eric Small. I'm a pediatric sports medicine physician with Mount Sinai and covering the U.S. Open. Today's topic will be heat injuries in the junior player. Heat injury is the most common cause of retirement for the junior player, and I want to go over the three severities of heat injury, talk about treatment and prevention. So we want to prevent heat injury from happening in the first place, but the most mild form of heat injury is muscle cramping, which typically there is a normal temperature. And number two, secondary severity would be heat exhaustion, which would be an elevated temperature of 101 degrees. Typically, the athlete would have excessive sweating, and they may have whole body muscle cramps. And the final stage would be heat exhaustion or heat stroke, which could ultimately lead to death. We have not had a death at the U.S. Open due to heat injury in a player, junior or professional, but there are preventative mechanisms. So let's review those now. Typically, junior players or young athletes do not have as sophisticated thirst mechanisms as adults. So when they say they're thirsty, that means they're already 5% dehydrated. Whereas an adult, when they say they're thirsty, that means they may not be necessarily dehydrated. So some helpful hints for preventing dehydration and heat injury would be 30 minutes prior to a match or heavy training session, the junior player should drink 8 to 12 ounces of fluid. Then they should be drinking 8 to 12 ounces of fluids every 15 to 30 minutes while playing. They should avoid caffeinated products like tea or caffeine or energy drinks. They should also avoid prescription medications such as pseudoephedrine or Adderall, things that could lead to dehydration. So in summary, junior players are more likely to suffer from heat injury than their adult counterparts, and there are ways to prevent that.